I know, but none of this means anymore. I don't know
Yeah.
if having 100 different labels does any good anyone or having all these
I'm
new
with you.
pronouns.
That's why I just say ditch
No,
them.
you're not with me. You're literally you're asking me
But
are there my
I feel like
pronouns
we're kind
are.
of on a wavelength here. You don't like the 100 different labels. I don't like them. I think that sometimes it gets a little bit, too much. I have to remember all these things, remember all these pronouns, whatever. And I respect people and I respect their decisions. But at the end of the day, I would love to just say fuck it all, get rid of it all. No more men, no more women. We're all just big genderless blobs, and we will all present the way we want and just be human beings. I agree.
Hi everyone. So I have today a special guest with me. Wawush 2.0. Just kidding. Alec, nice to meet you.
Nice to meet
So
you as well, Shapeshifter.
yeah, I saw you on Twitter and I decided to invite you on my channel because I want to have all kinds of people on my channel, not just people that agree with my point of view. And I promise, I mean, people complain that I talk a lot, so I'm gonna barely talk in this video. I'm just gonna let you talk because, first of all, you weren't feeling too well today, so I want to just do maybe
Yeah, I did
30.
lay down for a little bit. I didn't get a whole lot of sleep last night, but I laid down, took my afternoon meds, and think I'm doing all right now. So thank you for being considerate of my time and laying down and all
Yes,
that.
of course.
I appreciate
So
that.
I just wanted you, to get to know you a little bit and just hear your story a little bit. Like, how did you end up fighting for trans rights, and what kind of research you looked at, and that's it. So I guess let's just start. You identify as bisexual, right?
That is correct. I do.
That's cool. Like, I believe in bisexuality. I've been married to a bisexual guy, and I've dated a lot of bisexual people. However, a lot of people that follow me do not believe that bisexual is a thing. And that includes even some radical homosexuals that just believe somehow that people are forced to be bisexual because every gay person at some point had to pretend to be straight or something like that. I mean, I've heard all kinds of theories.
It is the oppression Olympics at work.
So tell me what you think about it. Like,
well, you're absolutely correct. I mean, it is unfortunate. We do have bigots even within the gay community who say like that bisexual people don't exist or they're running on easy mode, which, I am bisexual myself and I mostly am attracted to women. I'm mostly attracted to femininity. So for the most part, I am a straight identifying person and I'm fine being called that. I'm fine being known as that. My girlfriend is herself feminine identifying, though she also identifies as non-binary, but we won't get into all that right now. So, I for the most part, like I said, I am a straight presenting person for the most part, and I understand that I will never know the struggles of gay people, like people who are specifically attracted to the same sex. I'll never know that. I think that I, in most senses, had an easier time socially because of that, and I recognize that. But I think that focusing on our struggles and what society does not like about us in order to identify ourselves and decide who's in our in group and in our out group is not the way to go. That's not who we are. We are not just our struggles. We are beautiful creatures. We are composed of many, many more elements than just our struggles. And sometimes we focus a little bit too heavily on that, and that makes us divided. And I don't like that. So, I do agree with you. It does come from both ends, unfortunately.
okay, so you said your partner identifies as non-binary.
Mm-hmm.
Did I hear that correctly? Okay, so the way I noticed you on Twitter is that you were, I guess, firing back at in some conversations, and then I checked out your YouTube channel and I realized that you actually think that it's okay to put trans kids on puberty blockers, and I just wanted to know like where you're coming from, like how did you even end up in this fight?
Yeah,
And
absolutely.
what studies you have or haven't looked at possibly. And I won't be saying anything, I won't be opposing you, but if there is any studies, like I will definitely link them in the description down below, as well as I will link your Twitter and your YouTube. So people, I ask everyone not to send any hate. The point of this is not to hate on anyone, but to have a civil discussion and see eye to eye with people who think the opposite of you. That's all.
Yeah, so I'm showing the sources on my screen right now. It's in my Google Docs document. So I will be copy pasting this into the description real quick. So where can I do that? Is it in the chat or is it? Where do I put it?
I'm really new to this. I
Okay.
guess. Do you see any chat or I'm
There is
trying
a
to figure
private chat and there's comments, but it does not appear that I can post to the comments. But if you want, I can DM it to you and you can put it wherever.
Okay, I've never done anything like that, but okay, let's try that.
Yeah, sure. I'll go
Slide,
ahead and DM it real quick.
Google Slides. Yeah, I see some kind of chat here. So, oh my god,
It's
I
a
feel
private
such a
chat.
rookie with this.
It's chat with everyone in the studio, but I don't. I'll just DM it to you on Twitter, and if you need me to put it anywhere else, just let me know. It's a little bit. The formatting's a little
Okay,
bit janky, but I did include all the links. So let me know if
okay,
you need any
let's see.
clarification.
Whoa, so much.
A little bit of
Oh
a
my
research
god,
project I did.
I wish I knew how to put this. Yeah, do I copy the whole thing? Okay, let me see.
Um,
Copy, and then I'm gonna try to put it. Damn, let's see. I should have probably taken a tutorial or two
that's okay.
on how to do
That's
this.
okay.
Oh shoot!
I've never used this website before, so it's no worries.
Yeah, I know. I just signed up for this, and let me see if I can. Wow. Okay. Yeah, this won't let me do this. Well, I guess we might have to reschedule it, but we can still talk about it. I guess. I don't know how to do this. How to
Reschedule.
present it. Not reschedule. We can still talk. Like, okay, just I'll link all that in the description below. So if you can just tell in your own words, like statistics and whatever, like whatever you found, whatever you base your decision on, just try to tell it in words, I guess. I'm sorry, I don't know how to show it on the video.
Oh, no worries. I don't really have
feel like
anything to like. I only
I'm
have one
sorry.
thing to visually show, and like it's not really
Yeah.
something you can see that well anyway. It's just to kind of give you an idea of what it looks like. But we'll get to
Okay.
that later. So yeah, my name is Alec Leyendecker, aka Alec Gunter. You can find me on Twitch and YouTube. And Shapeshifter said that. I'm sorry. What were your pronouns again? I'm not sure.
Well,
I saw.
I don't do pronouns anymore because that's how I got in trouble. I took my
okay.
transition too far. So any pronoun is fine. I'm gender fluid, I guess. Sometimes I'm identified as a bimbo. Sometimes I identify as a grifter. So all jokes aside, like I don't do pronouns anymore. Anything you see me as is fine. I don't believe in forcing somebody to use certain pronouns. So that's where I stand right now. Thank
Okay.
you.
If it's all the same to you, I'll just go with they them.
Yeah, whatever is easier for you. Thank you.
Yeah, absolutely. No, thank you. But anyway, Shapeshifter was kind enough to. I'm sorry, I completely lost my train of thought.
You were gonna
Oh
introduce
yeah,
yourself.
you were
Yeah.
kind enough to link my links somewhere. I'm not sure where you put them, but apparently there's
I'm gonna
somewhere.
put them in the description. This is
Gotcha. Okay.
of my video once it's live. I'm so sorry.
No, it's fine. No. Yeah. So you were kind enough to do that. So thank you. I currently work as a mental health care nurse in drug rehabilitation. I obtained my bachelor's degree in biological sciences at the University of Cincinnati. I have my Master of Science in Nursing degree from Mount St. Joseph University. And I'm currently attending Northern Kentucky University pursuing my psychiatric nurse practitioner license. Like I said, you can find me on the links that Shapeshifter posted. And I use my platform to stream about a variety of political issues, but mostly we end up going back to social justice issues and civil rights, such as this. So just real quick, Shapeshifter, I'd like to thank you again for giving me the opportunity to discuss puberty blocking therapy with your audience. I hope you'll all learn something from this. And if you have any questions or anything you'd like to clarify, you are absolutely more than welcome to ask, in between. I'm not too stringent when it comes to like, pausing to clarify if anything's unclear. Before I begin, I'd like to clarify some of the terminology so that we don't get confused that I'll be using throughout the lesson. The terms male and female are going to be used to refer to individuals who are assigned male or female at birth, respectively, and who have not undergone sexual reassignment procedures. And they will also be used in reference to individuals who have successfully undergone such procedures. The terms boy, girl, man, woman, and non-binary may or may not be used to refer to the gender of individuals. Finally, the terms cisgender or cis will refer to individuals who identify with the sex they were assigned at birth, and transgender or trans will refer to individuals who identify with a gender identity that is incongruent with their assigned sex at birth. I'd like to ask forgiveness in advance if I mix up any of this terminology. We are only human and we all make mistakes. So I apologize. Give me just a second. I got to do something. Let's see. All right. So first, I thought that we would start at the very beginning. Talk about what is puberty. We're going to do the birds and the bees. So puberty is the transitional stage of life in which individuals grow to sexual maturity. The onset of puberty is about 11 years old. It's different for everybody. 11 years old for those who are born female and 12 years old for those who are born male. It consists of a release of endogenous hormones that are released by our bodies. For males, this is testosterone, and for females, this is estrogen. There's a little bit of there's a little bit of both in everybody, but depending on whether you're male or female, males tend to get a bigger wash of a testosterone hormone, and females tend to get a bigger wash of estrogen. The effects of these hormones on primary sex characteristics, on males, it would be the enlargement of penis and testes, as well as sexual function. And for females, it's onset of periods or menarche, growth of the uterus, and enlargement of the labia. The secondary sex characteristics that are affected are pubic hair for both. Males get voice deepening, among others. So they get, I forgot to fill that out. They get voice deepening, thicker hair, beard growth, stuff like that. And then females tend to get, their voice isn't really affected as much as males. The fat distribution, it goes more toward their hips. And they, there was one other, their breast tissue develops. So that's about it for the effects. It leads to what is known as sexual dimorphism, which is something that's present in humans and most vertebrates and results in a bimodal distribution of sex. A bimodal distribution, as opposed to a binary, implies that there are two main groups of things. In this case, it's people and their sexual presentation. And then there's some in between. So most people, the vast majority of people, will fall to one side of this distribution or the other. It's like two humps. And then in the middle, you have a bunch of intersex people interspersed. Binary, on the other hand, so like for binary code would be like ones and zeros. There's nothing in between 1 and 0 in binary code, and there's nothing outside of it. So we call it binary. Whereas with intersex individuals, we clearly see we have evidence of things that exist between those two, between male and female. Let me catch my breath for just a second. Sorry. All right. So, like I said, most of us end up at one end or the other. There's a chart by a professional researcher named Amanda Hobbs. It's the thing that I presented. I showed it just briefly at the beginning. You can't really see it that well. But I would like to read for you what it says in the top right. You can also search this if you search for, here, I can actually link you a link. Hold on. I have it pulled up.
Yeah, all the links that Alex sent me will be in the description of this video. Thank you.
Mm-hmm. Let's see. Where are you at? Well, I had to pull it up. I might have closed it.
Yeah, if you know how to do screen share, I think then maybe things will show up on your screen. That's the only way I can think of how to show people stuff. But yeah.
Present. Share screen. Here we go.
I see something.
There we go.
Oh, I see. Wow, perfect. Thank you.
Yeah. So this is what I'm referring to. I'll zoom out a little bit for you. In the top right, it says sex refers to a set of factors. Sorry, one second. There you go. Sex refers to a set of factors that determine whether an individual is considered biologically female, male, or intersex. These factors include chromosomes, genes, internal and external sex organs, hormones, and secondary sex characteristics such as breasts for females or facial hair for males. For those with disorders of sex development, DSD, these factors are not all aligned with typical female or male development. DSD traits may manifest themselves at different times throughout life, from conception to adolescence or adulthood. Individuals with DSD are also called intersex. This graph, if you zoom in, you'll also see, let me scroll in here, transgender men on this side along with cisgender men. So you can see there's kind of a a spectrum of all these different sex diverse conditions, I suppose it would be called. And then at the bottom, it also explains what non-binary, transgender, and all that is. And then on the bottom left, it says gender refers to whether an individual identifies as male, female, or somewhere in between. Sexuality refers to an individual's sexual orientation or the sort of person to whom they are attracted. It is also a spectrum, but it is separate from both sex and gender. So this visual was created by, oh, hold on. I'm currently sharing something else. It's my notes. Okay, there we go.
Okay.
All right. So this visual was created by a professional researcher named Amanda Hobbs, and I would like to state for the record, I could not find sources for the visual that she created. That being said, it is important to stress that this understanding of sex brings us a lot closer to equity for trans people and those with intersex conditions, which improves overall outcome. And in medicine, we are very big on the outcomes for people. That's the most important thing, is that people have positive outcomes, both in the short term and the long term. So that's about it on puberty and the sex bimodal distribution. Now let's talk about sex versus gender. We've gone over sex, which is physical characteristics informed by endogenous hormones. Gender is the societal roles that are assigned to us at birth based upon our sex. It includes things like clothes we're expected to wear, jobs we're expected to work, behaviors we're expected to exhibit, among other things. And most people's sex aligns with their gender, but some do not. We call these people transgender. By age 2, children become conscious of the difference between the two main genders, which is boys or girls, men or women. And then by age 4, children identify more closely with one, both, or neither of these. Those who do not identify with a role that aligns with their birth sex are termed transgender, or trans for short. Children who are trans may exhibit symptoms like wanting to play with opposite gender toys, wear opposite gender clothes, or prefer an opposite gender name. Most often, children will claim to be the gender that they identify more closely with, not simply express a desire. So what we would see in a child who may not be transgender, even though they're exhibiting some traits, would be, oh, I want to be a girl. Oh, I want to play with girls' toys, but they still are fine with the name George, or they're still fine playing with the boys, stuff like that. Now, they may end up being trans still. We don't know yet. But a more definitive version would be somebody who was born male, and they come up to you and say, "No, Mom, I'm a girl." And they're constantly wearing girls' clothes. They want to go by a girl's name. They may have already picked one out for themselves. It is a very clear, insistent desire. And again, this is not a universal presentation, but it is most telling in these types of children, and it does happen. So it's important to know that. Let's see. What's next? So before puberty, a child may visit a mental health professional who will make the determination whether the child is trans based on health history and presentation of the child. Best treatment practices for trans youth before puberty is gender affirmation. This typically includes things, and it's not all inclusive, but changing name or pronouns, wearing clothes of the opposite gender, and playing on sports teams and using the bathroom of the opposite gender. Essentially, they are just acting as the gender that they were not assigned at birth. So if you have somebody who was born male, they're dressing as a girl, they're going by a girl's name, they're acting like a girl, they're playing like a girl, etc., etc., etc. By any means that we can tell, besides their genitalia, they are a girl. So it's really more of a social thing until they're adolescents. So let's get into adolescence. What happens when they hit puberty, or they're about to hit puberty? We might put them on this thing that's called puberty blockers. And now we're getting to the meat of it. So let's talk about the history of puberty blockers just a little bit. I'm not going to chew your ear off on this one, I promise. Precocious puberty is something that occurs when endogenous hormones are released too early in children. It can be caused by a pituitary tumor or rare genetic conditions. And puberty blockers have been used since the 80s to treat this. So we have a long history of using puberty blockers, over 40 years. It comes along with very few life-threatening complications, actually. It's mostly only visual presentation and early presentation of adult features on somebody who might be much younger than the age that they're presenting the features as. The most serious long-term complication of precocious puberty is shortened height, because the bones harden quicker and they don't have as much time to grow. Nonetheless, even with these very low risks of precocious puberty, we still take into consideration the mental health effects that it has on them. When a child who is 10 years old, shoots up to a taller height than the rest of their peers, if they have facial hair at 10, if they start getting acne, that can affect them socially. They might get made fun of. They might not like how they look in the mirror. It is not great. It's not great. So Even if there's no immediate life-threatening concerns, we have nonetheless accepted puberty blockers as a good treatment for this. It can also be used, just as a side note, in prostate cancer, heavy flow periods, endometriosis, and high T in women. High testosterone, sorry. Okay, the purpose of puberty blockers is to prevent early pubertal development in transgender youth or those with precocious puberty. The most common types are called gonadotropin-releasing hormones, GnRH analogs, of which there are depoluprin. Depoluprin is a subcutaneous injection that's taken every 3 months. Subcutaneous meaning it goes into the fat tissue. And then histrelin is a tube that is inserted under the skin in the upper arm, about right here. It's a very small tube, and it stays there for about 18 months. So it's a little bit more invasive, but the benefit is that you don't have to go in quite as often. So with gender dysphoria and gender incongruence in youth, hold on one second. Just catch my train of thought.
I'll jump in for a second.
Sure.
I also feel like I went through puberty early because I remember at 10, 11, I already had like little facial hair and I grew actually some titties too. So actually, I'm going to have my endocrinologist see if they can test me for DSD conditions, because I feel like a lot of people who think they're trans sometimes end up actually having DSD, and I've never been tested actually, which I think they should have tested me before giving me like cross-sex hormones, but it is what it is at this point. But I do also remember being made fun of by kids in school because, they were like, "What the hell? You have like a little mustache already?"
Oh, no,
and I had little tiny titties that were showing through my boy shirt, and people made fun of me too. Just wanted to jump in and bring that up. Okay.
Yeah, it's not great. I had some bad acne. I did a chemical peel maybe a little bit too early on, and that helped get rid of it. But I had some bad acne, and I was starting to get like a patchy beard and stuff. So not quite. I don't think it was that bad, but it was there. Puberty hits us all.
I'll mute myself. Okay, go ahead. Thank you.
Yeah, absolutely. No, thank you. So I want to talk a little bit about the research. Sorry. Hold on. Yeah, so I just have a little bit of information from Boston Children's Hospital that I want to go over. Children are typically diagnosed with gender dysphoria if they have experienced significant distress for at least 6 months and at least 6 of the following symptoms. They have a strong desire to be of the other gender or an insistence that they are the other gender. Strong preference for wearing clothes typical of the opposite gender. Strong preference for cross-gender roles in make-believe play or fantasy play. Strong preference for the toys, games, or activities stereotypically used and engaged in by the other gender. Strong preference for playmates of the other gender. Strong rejection of toys, games, and activities typical of their assigned gender. Strong dislike of their sexual anatomy. And strong dislike for the physical sex characteristics that match their experienced gender. So, like I said, there's about at least 6 of the following is what they're looking for. It varies. It takes a team of professionals typically to determine this. Risks of gender dysphoria include distress, anxiety, depression, negative self-image, strong dislike of your sexual anatomy, and strong preference. Hold on, that's actually 2 other. I don't know how that got copied down there. It's distress, anxiety, depression, and negative self-image. My apologies. The distress that is related to this condition has been associated with an increased risk of substance abuse, self-harming behaviors, and suicidal attempts. This is mostly because of the increased risk of discrimination for individuals who are transgender or gender nonconforming. So we see a lot of social backlash when people try to identify as a gender that they were not assigned at birth. And that is primarily what contributes to these mental health problems. A lot of thing that gets lost a lot of the time, I feel like, is we think that the state of being trans is what's causing the mental health problems. And that can certainly be a factor even without the social influences. But the main problem that leads to self-harm and suicide is the social influences, the social pressures to identify, to conform, basically. And, it's sad that we have to kind of work around that, but that's where we're at. So that was all from, like I said, the Boston Children's Hospital. That was all directly quoted, just so you know. Criteria to be met for puberty blockers. This is also, I believe, directly quoted from the Boston Children's Hospital. They must have long-standing pattern of gender dysphoria or incongruence between gender and sex, gender dysphoria that began or worsened at the start of puberty. So you may have been fine up until puberty, but then suddenly you start to develop breast tissue, or you start to see that your testicles are getting larger and you're growing facial hair, and you don't like this. You decide this is not for you. No, thank you. And you want to put a stop to it. That may be, if you get analyzed by a professional, once again, that may be part of the assessment that goes into starting on puberty blockers. Let's see, other criteria. All medical, psychological, and social problems are addressed first. Another thing that gets lost a lot in the conversation, unfortunately, is we think that people go in, children go in, almost like they're going up to like a McDonald's drive-thru to get a Happy Meal, and they can just pick up their puberty blockers. That is not how that works. There is a lot of screening that goes into this. Like I said, typically they want to monitor a child for like 6 months at least before they would start somebody on puberty blockers. And again, it is a team of professionals that determines this. So they also address like depression, anxiety, social factors. They look at all of this stuff first. They rule everything else out. And then they decide that puberty suppression is what is needed in the circumstance. So they must also have entered the stage of puberty already. So puberty blockers are not given to children. I would say the earliest you'd probably give it is 8. And really that's if they're really starting puberty early. So typically it's more like 10 to 12 years old. There also must be informed consent. And this is another big one with children. The extent to which a child can consent is limited to their parents and guardians. However, it's important to note that the effects of endogenous hormones are far more permanent and can cause far more immediate physical and mental damage. So what this means is your body is already releasing chemicals that are permanently altering your body. They can be reversed to some extent, but not really. They're more permanent. Children can no more consent to these chemicals being released in their bodies than they can to any medical treatment we provide. So really, if you break it down, it makes a lot more sense to go with the less permanent option until a more sound decision can be made, usually by the time they're 16. So let's go over some of the benefits of puberty blockers. It leads to increased self-esteem, decreased depression and anxiety, and this is all for transgender youth. Decreased depression and anxiety, decreased risk of self-harm and or suicide, decreased need for future surgical procedures, almost completely reversible, by which I mean there are some long-term side effects, which we will go over. It can be stopped immediately and puberty will resume. And it gives transgender children more time to decide if this is a treatment that they would like to pursue. Like I said, I would much prefer a 16-year-old making that decision than a 12-year-old just letting nature take its course and not knowing what the consequences of that are going to be. It just makes a lot more sense. There is overwhelming evidence for the support of puberty blockers. So a 2020 study, and I'll just go over a few of them. I don't have like the whole wealth with me. But a 2020 study by Turbin et al. Examined over 600 transgender people aged 18 to 36, and they found that those who were treated with puberty blockers showed significantly lower risk for depression and suicidal ideation. In addition, there was a 2021 literature review. It was a critical literature review by Rue et al. It went over 200 studies, and it picked out 9 that fit the criteria they were looking for. And it concluded that there is substantial evidence for the potentially, and this is quoted, potentially life-saving benefits, end quote, of puberty blockers in transgender youth. Further, it's supported by most major medical organizations, including the American Academy of Pediatrics, the Endocrine Society, and the American Psychiatric Association, among others. That is a very incomplete list, but I just wanted to give you a few. So, let's go over some of the risks. This is what people are afraid of, right? We're very afraid of both the short-term and the long-term risks, so let's talk about them. The short-term risks are injection site swelling, and we'll see this with many, many injections, and this is no exception. Weight gain is one, hot flashes, and then headaches. Those are the major ones. There could be some various other ones, but they're rare and far between. The long-term risks, not all of them are completely understood, and this scares people. When we say that we don't understand the long-term effects of a medication, we saw this a lot with the COVID vaccine as well. There was a big scare about, what if I take the vaccine now and then 20 years down the line, it gives me a heart attack? technically that's possible, but we have to take the wealth of data that we have currently and make a best decision based on that. If we were to do that with every medical treatment, we would still be cavemen in the field of medicine. It would not be good. So, but it is nonetheless something that scientists do consider when they study this stuff. And so there is preliminary data, which shows that the long-term risks are minimal. Let's see. There was a long-term follow-up study after 4 to 6 years, which granted is not very long when it comes to lifelong effects, but it's the best, some of the best we got so far, of patients with precocious puberty that shows that after hormone blockers are ceased, there are very few long-term risks. And in fact, they only really had benefits from it. There were very few drawbacks. Another one is a case study. Now, this basically amounts to an anecdote in the scientific world. It is the lowest form of evidence, but once again, we are going off of what we have. So this is patient B, who had a 22-year follow-up. They are a transgender male, and quoted directly from this article, although B would have liked to be taller, we did not find unfavorable medical outcomes. Therefore, the fear that GnRH analog treatment will result in poor long-term outcome was not supported in this case. It is very specific to include the words "in this case." We only have case studies so far and very limited research on it, but what we do have supports the fact, or supports the idea that there aren't a whole lot of long-term side effects, which is good. So let's go over what those side effects are, or the ones we do know, I should say. Low bone density is the biggest one. For that, doctors recommend calcium, vitamin D, and exercise, and that's there's a guide that they will give these people to go over. And shortened height is another one. When people go on puberty blockers, they will typically be like an inch or two shorter than they would have been otherwise. But when doctors weigh the risks and benefits, I would rather have somebody who's an inch or two shorter than somebody who genuinely just is not a good fit inside of their body and is miserable. Just trade-offs we have to consider. So fertility is another big one that people are scared of. So the timing when it comes to puberty blockers is important. Puberty blockers by themselves do not affect fertility. However, if you are to give cross-sex hormones while you are still on puberty blockers, or you mess up the timing, that can sometimes lead to effects on fertility. This is a mistake that is possible to make, but with physicians who know what they're doing and are being careful, this typically will not happen. It's just one of the risks that they do have to go over with you. It's one of the rare things that can technically happen, but probably will not. Very, very probably will not. So, like I said, the timing is important. As long as you get that right, puberty blockers by themselves have been shown to be 99% reversible, other than the bone density and the decreased height. All right. So, almost done here. Mental health therapy is recommended both before and during puberty blocker therapy. We want to make sure that these children are indeed getting the best treatment for them. We want to make sure that their health outcomes are benefiting from this and not declining. And like I said, we would continue this mental health treatment all throughout their therapy, just to see how they're doing. And the length of time that they take these puberty blockers is typically about 4 years. Once you get past 4 years, the effects that it can have on bone density start to become a little bit more dangerous. So, you might start seeing more brittle bones after that period of time, to the point that you could more easily get fractures, get injuries, whatever. So we tried to stop that at about 4 years. And that's why we go between like 12 and 16 years old, as opposed to between like 12 and 18, 12 and 20, et cetera. They are still doing research on ways to completely suppress puberty in people who would want to continue their puberty suppression longer, but it is still in its preliminary stages. And like I just said, since puberty blockers affect your bone density, it's not recommended past 4 years. So in conclusion, all of this data, all of it, overwhelmingly points to the benefits of puberty blockers for children who are in the earliest stages of puberty. As I said, it is the less permanent option when you consider that versus endogenous hormones, which result in permanent changes to the body. You have to take into consideration the consent of a child, both for the hormone blockers and for the release of endogenous hormones. So it's an important thing to take into consideration that I feel like is lost in the conversation a lot. So a team of professionals will always be involved. Mental health care will always be involved. It's not like you just drop into the clinic and go, boom, there's your hormone replacement. We don't do that. Or your hormone blockers, I should say. That's not how that works. There's a process. And we have to have a base of medical knowledge that we can trust to proceed with the best processes for these children. We do it with cancer treatment. We do it with mental health, ADHD, depression, anxiety. I don't see any reason why we can't do it with gender dysphoria and hormone blockers. So that's about it. That's all I got for you. I linked you the, man, I need a water.
Okay. Yeah.
Talking.
Thank you thank you for sharing. I mean, I knew I was not gonna. I promised I was not gonna say oppose you, but I do have a couple of questions.
Of course.
Drink your water, and I'll ask you. Well, for one, gender nonconformity got thrown in there, which is like, I had tendencies to gender nonconform since I was a kid, and you did bring up society. So how much of it do you think is innate, and how much of it societal pressures that kind of dictates people what they can or cannot do based on what they have between their legs? And also, I had a question. Well, what's your opinion on that one, first of all? Like,
this is a nature versus nurture question, which is extraordinarily difficult to answer. Going all the way back to my education in biology, we talk about this a lot. There's this thing called epigenetics as well that we have to take into consideration, where your environment can actually influence your gene expression, which is insane to think about, but it's true. It does happen. I think it is definitely a combination of both. Especially if we look at the fact that in the autistic population, people with autism tend to be transgender at a higher rate than the neurotypical population, which is a very interesting thing to look at. And I have just so you know, I've not personally done the research on that element, but my take from that is that people with autism generally are not looking at, they generally don't care as much about societal expectations of them or their gender expression. So as they get older, as they mature, they can kind of they can distinguish between the genders and kind of decide for themselves which one they fit with better, regardless of what's between their legs. So to take away from that, I think that it is strongly socially influenced. Gender, after all, is a social construct. You might notice that I am a very masculine presenting person, but the beard, my decision to have a beard, regardless of whether I'm capable of growing it or not, is part of my gender, right? It's part of my gender expression. My decision to be bald rather than wear a wig is part of my gender expression. So it is very strongly socially influenced, but at the same time, we have to think about, is it a genetic thing to choose how we want to look, to have a preference for how we want to look? Think about it like this. I put it like this sometimes. You might prefer pizza over burgers, right? Whether or not you prefer pizza over burgers will influence whether you pick to eat pizza or burgers, right? But do you really get to choose which one you eat, but do you get to choose which one you prefer to eat? You know what I mean? Do you get to choose which one you prefer, which one tastes better to you? You don't really get to choose that, right? So it's complicated. Is what I'm saying. It's definitely a mixture of both. I do think there is a very strong social element, though.
Another question is, how do you opt out of something that you never had? Like, how can people opt out of male puberty if they don't know what male puberty feels like? And vice versa. I feel like puberty is probably scary and confusing to everyone, whether you're cis or trans or whoever. What's your opinion on that? Like, do you think it's fair that some kids may never be able to go through male puberty? Like, they don't want to look like a man, I guess, but they don't know what male puberty entails because they're opting out of it.
Right. Well,
They
I
just
mean,
know what, yeah, they know what male puberty will do to them
right.
externally, but they don't know what it will do to them internally. And same on the other spectrum. So it's like, as somebody who had like the surgery and everything pretty young, I do kind of wish I had more time to discover what kind of like masculine I was,
Mhm.
versus like deciding so early on that I'm 100% a woman.
Right.
So yeah, what's your opinion on that?
Yeah, so there are a few things that I'll say about that. First, I want to address your first point and then your second. Your first point was, how is it fair that you'll never get to like personally experience male puberty? How is it fair that I didn't get to experience female puberty? I never got to experience what it's like to have estrogen released into my bloodstream, nor do I really want to. It's just
No,
not
that's not what I meant.
right.
I meant
Okay.
like, let's say you're a male, right?
Mhm.
Assigned male at birth,
Mhm.
and you're about to go through puberty, and you're being let's say you're seeing you're a girl, and you're like, I want to wear dresses. I'm a girl, mommy, daddy, and they put you on blockers. So you never end up going through male puberty, and let's say later on you're being put on estrogen, so you never experience what it's like to be super horny and have like your first orgasm, like, and realizing like, oh my god, what did my body just do? It's like same with girls, like, if they block themselves, they'll never know what it's like to have your first period, and they will never have that experience. So how can you opt out of like eating burgers if you never tried one? That's what I'm trying to say, like.
Well, right, but again, this is a decision that we have to make uh, based on the best data that we have. Again, I want to stress, I did not get to choose whether or not I went through male puberty. That's just what I was born with. That's the parts I was born with, the chromosomes I was born with. I didn't choose that. I chose to stick with that after it happened. I'm happy with the results, but I didn't get to experience female puberty. Uh, if I had it my way, I think that it would be awesome if we could run a years long simulation for people and they can decide that way. Like, here's what it's like to go through male puberty. Here's what it's like to go through female puberty. Why don't you pick at the end of it? I think that'd be great. But unfortunately, we just don't have that technology. So I think it's less fair to subject a 12-year-old to the long term effects of endogenous hormones than it is to give them something that's far more temporary and let them decide at a later date which path they want to take based on the evidence they have. I just think that makes more sense. And then the other point, the other point to address was, what was it again? I forget.
I forgot to.
I,
I have
I
brain
can't
fog due
remember.
to estrogen, and like I'm taking both testosterone and estrogen, but I'm still
I
brain
remember.
fog.
You said you were rushed into it. Is that right?
I had my surgery early on,
Okay.
and I was only 24, but I feel like I wish I had more time to grow into my manhood to realize that I was like a special kind of a man versus actual woman.
Mhm.
So I don't know. I just feel like, how can you choose out of like being treated as a man versus woman in society when you didn't even have enough real time to experience what it's like to be treated as a man versus woman? I guess I had more of that experience than like kids that get blocked out earlier on. So
Well,
like I'm in the transitional community, and I do have a lot of women that's detransitioned, and
mhm.
they always cry about how they never got experience like woman. They opted out of womanhood before even getting to know what that meant, because they were like literally 16
By
or even
24?
younger sometimes. What?
But
Sorry.
you said you were 24 when
I
you
was 24 when I had the
okay. So
surgery. I had the
I'm
bottom
wondering
surgery.
how old you feel like you would have had to be before making that final decision, because 24 is
Honestly,
relatively, it's not old, but it's like adulthood. That's well
it
into
is, yeah.
adulthood.
But honestly, like, looking back, I wish I had more time with my original parts. I
Eh,
definitely feel like I was not in a good place to make that decision. And also, I'm neurodivergent, so I was looking into some research, and we do have like 18-year-old cutoff for adulthood, but it takes some people longer to mature. I don't think looking back, I was fully conscious of what that decision, how it affected my whole
what
timeline. But regardless, like, I do know people in detrans communities that were like transitioned young at 16, let's say, something like that. And they always, like, literally in their confessionals, one of them was crying how she never got experience the womanhood before opting out of it. So what I'm saying, obviously I had some time to experience what it's like to be treated as a feminine man and gender non-conforming man and all that. But some people didn't even get a chance to have that because they were like kind of blocked out and transitioned, So now they're realizing they never got a chance to have that,
I guess I'm a little bit skeptical of the implication that at 24 you can't really make that decision. I mean, we have age of consent at 18. Now we can discuss that and see if it needs to be older. I personally think it does, but 24 I feel like is pretty well into adulthood, and at that point it's kind of more like you can be misinformed, you can be misled, but to what and we can talk about that, but to the extent that you're a self-fulfilling adult, I feel like that's old enough to make that decision. As far as 16-year-olds go, I agree that there are definitely circumstances under which people who are young, maybe not 16, but like 17, 18, 20, whatever, are rushed. I get that. It does happen. And the reason it happens is not because of social pressure. The reason typically is because of insurance. And I know that sounds like a weird thing to talk about, but it's true. As somebody who is in medicine, I experience this all the time. I work in drug rehab and Sublocade. Just to give you a little bit of a crash course, Suboxone and Sublocade are both, it's Subutex and Sublocade are both basically the same drugs. Subutex is the mouth form, Sublocade is the injection. Insurance will typically cover the mouth form of it, the sublingual, but the injection takes so much longer, So, and we also tell clients before they get off of it, right? Before they get off of Sublocade, if you get off of it, insurance probably will not cover it again if you want to get back on. You can't flip-flop back and forth, but literally only because insurance will not cover it if you stop. I think that's an enormous problem. I think that takes away a lot of agency from people. And it's the same problem we see when people feel rushed into these procedures. Because if you put it off and off and off and off, insurance is going to be like hesitant to cover it later on. I don't know the exact reasons why insurance does what they do. They do some really wacky things sometimes, but we can talk about the whole medical system and why insurance is so bad. But that's really the main issue with why people feel like they're being rushed. And it is a real problem. But it's not a problem with society or societal pressures, I should say. It's insurance. It's the profit motive in medicine.
Right. In terms of the transitioners, the girls that we're talking about, because some of them got masculinized. So now they have like deep voices and they were complaining how they missed out on like being perceived as woman. And now it's hard for them to, get perceived as one when you have deep voice and you have certain like secondary male characteristics, and they kind of opted out of societal perception of a woman. So now they regret it. But yeah, I agree that 24, I guess I was an adult, for sure. But anyways,
and to be
you'll
clear,
be back on my channel. We will talk about the whole.
Of course, to be clear, the last thing I would want to do is downplay your experience. I'm very sorry that you felt.
No, that's fine. You weren't downplaying, and right. That's a whole. So you mentioned an example. You said anecdotal example of a trans kid, I guess, who was Correct. Transitioned, and you mentioned something 22 years. So wasn't the study? Was it 22 years? Like was a individual 22 years old, or was it 22 years post?
It was a 22-year follow-up. So. The individual, I believe the individual was in their 30s by the time they were following up. They had been doing, they had done hormone blockers from the time they were 12. Like I said, I did clarify while I was saying it. This does amount to an anecdote. The benefit that this has over an anecdote is that it was done in a professional manner by people in the scientific community, and they hold each other accountable. That being said, it is a single case. It's not a lot to go off of. So we do still have a lot of work to do when it comes to the long-term effects of puberty blockers. This is true. And it's unfortunate reality for many treatments. We'll never know the long-term health effects of the COVID vaccine, for instance, until decades and decades down the line. But we have to go with what we have in front of us. We can't just put it off because we fear that people might have side effects 50 years down the road while people are dying right in front of us. That doesn't make any sense.
Okay, I guess, In a way, it is experimental because we don't know, right? We don't have enough studies showing that like
Well,
this many trans kids have been transitioned.
it's not considered experimental when we have this level of evidence in favor of it. It's no longer in an experimental phase. Clinically, that is incorrect to say.
But are there any studies showing enough trans kids have been transitioned and followed up 10, 20 years down the line, and those kids
No.
reported that we don't,
Well,
right?
again, there's the case study, but this is a process that takes decades. We have to actually start somewhere. And there may be a time when we figure out 30, 40, 50 years down the line, oh no, the hormone blockers made their heart explode. Look at that. But we don't have that yet. And we have no indication as to why we would suspect that. So until we do, hormone blockers save lives. They save lives. And so we have to go with what's in front of us. That's just what makes sense.
They save lives in terms of suicide rate. Is that what you're insinuating?
Yes.
Okay. And from the studies that you looked over, what is the percentage that commits or attempts suicide, like if they're not treated?
If they're not treated, I know. I didn't look into that specifically. I did point out the study. Let's see. Let me scroll back up. 2020 study by Turbin et al. Examining over 600 transgender people age 18 to 36. I can pull up the exact link and quote it if you would like. Let's see. Turbin.
That's okay. It's just like there is a 41% that's being thrown around, and I know that has been debunked already, kind of, for the most part. And
I think 40% is the overall suicide rate for transgender people. It's insanely high. And the overwhelming effect we've seen hormone blockers have is a reduction of that. So, like I said, the studies support that.
But also you said earlier that adverse mental health effects was a lot because of societal pressures that do not accept people who are transitioning or gender nonconforming. So a lot of it is also possibly induced from the outside, not so much the medications taken or not taken.
Well, that's kind of how we do a lot of medications, is it not? I mean, think about it. That's why a lot of people take antidepressants, anxiolytics, I should say. I take ADHD medicine to keep me focused when I'm at work. You know, societal pressures are a big reason to take all kinds of different medications.
Well, you can be depressed not because somebody hurt you or broke up with you. You could be depressed because you're lacking certain chemicals in your brain, and then it's coming from inside. Like I struggled with that too. And but if you're wearing a skirt and you're a dude and people hate you,
to that point,
that's definitely not coming from inside.
You can consider every process in our brain a chemical one. I mean, the process of eating is putting chemicals into your body and to your brain. You know, they're all chemicals. So every time you have a thought, that's a chemical reaction. So that's a very vague term that I feel like is sometimes abused. But like I said, and society causes a lot of those chemical reactions. It's a cause effect. You know, the society has an effect on your brain, which causes you to self-harm if they are abusing you for being trans or whatever other reason. You know, that is a chemical effect that society is having on you that is mitigated and corrected by treatments such as we're talking about hormone blockers, and then later hormone replacement therapy.
Okay. Well, thank you for your time. I really appreciate you coming on my channel.
Yeah, absolutely.
I wanted to ask everyone not to send any hate. Please follow him on Twitter and his YouTube channel. And hopefully this video will do well and we'll get likes. I wanted this to be informational. You know, we want to hear what people who are opposing our reviews think, you know,
absolutely.
And where they're coming from.
This was very productive. I really appreciate you giving me a spotlight, really.
Yeah, of course. I feel like we did.
I feel like I learned a lot too. I did a lot of research for this, so I learned a lot too. This was a great experience for me. And I feel like I know a lot better what I'm talking about.
Time. Oh, I guess I had one question. I forgot.
Sure.
Again, brain fog. So you did mention something about autism, and what I've observed in my community of detransitioners and some other trans people I know, there's definitely a lot of like other comorbidities and other issues. A lot of people are neurodivergent that are also identifying as trans, and they do have like borderline, bipolar, and all kinds of other issues. So do you believe right now? Is that like transing is completely separate issue from all those other issues? Or do you think there could be correlations between all this cluster B, I guess they're called cluster B personalities or whatever it's called, and people identifying as trans?
Just
Do
as
you
a
think there's
side
any
note,
correlation?
cluster B
Yeah.
refers to personality disorders. Autism doesn't really classify in that. But
Yeah.
I understand your point. To that point, there is undeniable evidence that certain types of neurodivergency coincides with being transgender. And as I said, I think I have not looked into this part very much, but from what I know of, social influence on mental health, on mental processes, I believe that people who have autism, because they are less socially adept, typically it's less socially adept, less socially aware, that they're not paying attention to the distinctions between gender. They're not really trying to identify with one or the other until much later sometimes. And I think that, and also they don't typically care as far as, fitting in goes, right? So they can look objectively at society. And I think honestly, this could be seen as a benefit. They can look objectively at society, look at these different gender roles and say, hey, I like this one, or hey, I like that one, or hey, I don't like either of them, or I like both of them. I think that's really neat, honestly, and that leads to a lot of diversity when it comes to our expressions. Like I said, it is linked to autism, but just saying that it's linked, I feel like is lacking a lot of nuance when we talk about it.
Okay. On a personal note, from my dating as a trans woman when I was identifying as one and I had a dick, to like now, I also feel like a lot of people that I end up dating and like ending up in a relationship with also are neurodivergent. I think they see gender also on a spectrum. So they see trans women, I guess, as woman. And yeah, that's what I've noticed too anyway, is that like often people that end up in a relationship with are also neurodivergent.
That are in an open relationship, or that you've been in an open relationship with, you said?
No, I didn't say open relationship.
Oh,
I
sorry,
just said like people that I dated over time also end up being neurodivergent. So,
well, people who are
I've noticed that a lot of neurodivergent people are attracted to trans women or gender non-conforming people, non-binary, whatever you want to call them, like, or I don't know, whatever. So people who don't like conform to gender stereotypes, that's what I've noticed.
Yeah, exactly.
I guess it's just autistic people, or I should say neurodivergent people in general, just see things differently,
Right.
Yeah. That's what I was trying to say anyway. Okay. Well, it was nice having you. And I'm hoping that we'll do this again sometime, and maybe next time we'll have somebody debate you, or I don't think I'm good at debate because I'll probably get so much anxiety. Like
it was very difficult for me at first, but once you start getting into the flow, you kind of get that fire in your belly and you're looking for it.
I may have to actually debate Bausch, and I don't know how I'm going to do that because one thing about detrans community is like nobody is like fraternizing on purpose because we don't want to be like trans community. We just want to be individualistic. We don't want to have flag. We don't really like talk to each other too much. And that's the point. Like whenever I was trying to get some people to debate him from detrans community, but nobody's on board. So I may have to do it like in November on Modern Day Debate, but we'll see.
It can be tricky.
Yeah, I know. I hope it doesn't start
especially Vosh, kind of the king of debate right now, as it were. So sincerely, best of luck. I would not wish to be in that position.
I know. I hope I don't have to. I hope I can get somebody a little more brave than myself, but
fair enough. No, that's understandable.
Yeah. Thank you for your time. I'm going to stop recording.
Absolutely. Thank you for your time. I appreciate it.
Yeah. Let me just stop this. We can just chit chat a little bit.
Yeah, of course. I'm still live, just so you know.
Oh, okay.
Just so we're all
you can end that too. So we can just like private chat.
Oh, do you want to just private chat?
Yeah, or if you want to ask me a question for live chat, that's fine too. I can do that because I don't know how much you know about my story. You don't like.
I don't know a whole lot about your story. I did look a little bit at your YouTube channel, but I didn't look too far into it. So you said that you went into some kind of surgical procedure at 24. Is that right?
Yeah, I had my bottom surgery at 24. That was complete disaster.
Mhm,
My vaginal tunnel started shutting down no matter how much I dilated.
mhm,
And then I had another surgery a few months later where they like didn't take any skin graft and just like opened me up and sent me home to dilate.
mhm,
Which looking back, what the fuck? Like they didn't take any skin graft from anywhere. So needless to say, that shut down as well, no matter how much I dilated, which is like, and they completely blamed me that I wasn't dilating enough. Then I had colon vaginoplasty.
yeah. Well,
So
I've heard of that, but
that was
it,
complete disaster because they also didn't. This time they told me not to dilate till they give me a green light, and by the time they gave me a green light, it's already constricted. The part where like
oh,
colon was attaching to the rest of like vaginal graft, and then they tried to do like Z-plasty, trying to like release the scar, upon which they poked fistula, like colorectal fistula. Obviously, after that, they told me not to dilate. And then they tried to repair the fistula. And when they were trying to repair that,
mm,
they kind of like they were like they did a test. They were like, oh well, he's healing on its own. You don't need any surgery. But they dilated me under anesthesia and sent me home. Upon which they tore me back open, my fistula, and it was just like ever since then I wasn't really able to get any revisions because nobody knows like what to do anymore.
mhm,
So it was just completely ruined surgery, and like I thought I was like in 1% was complication, but like when I came on YouTube like 4 years ago and talked about my complication, I had so many people reach out to me. A lot of them had colostomy bags. A lot of them just ruined their lives literally because, yeah, the surgeries after being through the system, the surgeons don't know what the hell they're doing. Vaginal stenosis is a big problem because it just keeps on trying to shut down no matter what you do.
mhm,
And I know it's like a turf rhetoric using like a wound, but honestly, your body does treat it as a wound and it's constantly trying to shut down. And just like the surgeons completely did not tell me all the risks. They didn't tell me that I should have been using like estrogen cream to make it easier to dilate. What else didn't they tell me about? Like it was just like a mess. They didn't tell me that I still need to take some testosterone to even have a sex drive. So I went years of my life without even like having any interest in sex. I thought I was asexual till I tried to detransition and started taking testosterone recently. So yeah, it's just like very traumatic. I realized like I lost years of my life. Now I have osteoporosis and
I'm
scoliosis.
I'm very sorry to hear all of that. That
Mhm.
sounds traumatic. You know, it sounds like you didn't have a very on your side kind of medical team, and again, that is
No,
such a bad
yeah, I
problem.
didn't. And nobody
Such a
actually,
bad
I was
problem.
living with a plastic surgeon for 2 years as my partner.
Mhm,
And nobody told me that I was supposed to be on some kind of hormone after the surgery, like literally
mhm,
all the surgeons that did revisions on me, they were like, never. I told them like I wasn't taking estrogen. They're like, nobody said like, why the fuck are you not on any hormone?
mhm,
Neither did my partner, who's a medical professional as well. He's an actual surgeon in Florida, not like gender surgeon, but he's a plastic surgeon. He's an MD. So my healthcare was completely mismanaged. My general practitioner never told me that I was supposed to be on some kind of hormone for
mhm.
my bone health. So yeah, I have some strange lump in my breast. I don't know what that's from. Like nobody knows. After doing MRIs, I
Jesus.
absolutely hate all the surgeries I had done. I realized like I was not a woman, and I was just like I was just a gay man that got bullied by society for gender nonconformity and for my femininity. And I literally transitioned just to fit in and so I could wear feminine clothing. And I was living a lie all these years. Like I was like, yeah, not to mention brain fog, and I was so lethargic for years. And I got so much more depressed after the surgery, and my mental health like completely declined. But I was completely gaslit by trans community that was just telling me that it's a post-op depression and that I need to put other goals in front of me. But what I realized, I was just a castrated man, and testosterone has all these amazing benefits, and I didn't know what I was giving up. I was
Right.
literally. I didn't feel like I needed to do all this research. I saw that people in white robes had my back, and
Mhm.
nobody realized that I grew up in a third world country where I was like bullied mercilessly for my femininity, and I had a lot of internalized homophobia. The minute I realized like trans was a thing, I latched onto it. Before that, I never hated my penis. I was completely happy being androgynous man,
So were
being
you
gender.
was the procedure, sorry, where did you grow up at?
I grew up in Eastern Europe. I haven't
Gotcha.
revealed the country to anyone yet, but I grew
Okay.
up like in a predominantly Muslim country. So I was like, so obviously it's very Islam is homophobic. Like, hello,
Just
they're
to
like
clarify.
transitioning gay men, yeah, in Iran into women. Like,
So this did take place in like Mid-Eastern Europe.
well, as the countries that I'm from, it is like Middle Eastern / Eastern
Gotcha.
Europe. Yeah, yeah,
Okay. I just wanted to
yeah.
clarify because I do
Oh my god.
believe that like especially in Middle Eastern or sorry, mid what is it? Mid Eastern Europe, sorry, not Middle Eastern. Eastern Europe and like for lack of better terms that come to my head, I guess second and third world nations. Oh, hello? You still there? What happened? I'm alone. There's nobody here. Nobody.
Sorry.
Oh, there you
Yeah. I was trying to download the file, and it's like I don't know what
are.
happened.
Oh, okay. No, but
Yeah. Anyway,
what I was
yeah.
going to
Go
say
ahead.
was like, countries like that definitely have uh, deficiencies in their medical processes. And I think that's really worth addressing. Even this country does, the US.
Dude, I
Um,
was transitioned in America. Like I
you
was
were
transitioned.
transitioned in America. Okay,
Yeah,
gotcha.
I live in Massachusetts. I was given letters by Fenway Hills and had my surgery in Pennsylvania.
Gotcha.
No,
Okay.
I had no idea what trans was till I went to graduate school here.
Mhm.
And that's when I met like non-binary people, and like people were started asking me what my pronouns were because I was just like had longer hair and was like naturally feminine. And that's when I started questioning if I was a woman.
Mhm.
And the minute I took hormones, like I started just like getting bottom dysphoria, and I got brainwashed by trans community that
Right. We
men who
remember
were
that.
in any shape or form wanted to interact with my penis were just tranny chasers that fetishizing me, and they don't see me as a real woman.
Right.
Like
It's
newsflash, like I was never at none of those points I was ever a real woman. Like,
right.
I mean,
It seems
in my opinion.
unfortunately you were not surrounded by the best people, and I'm very sorry for that.
I
Um,
mean, it's kind of hard to surround by best people when most of trans community are just jerking off on OnlyFans and
I don't
prostituting.
know if that's most of them. I know many trans people, and they are most of the vast majority of them tend to be quite wonderful people. By soft
No,
standards, you could consider my girlfriend trans. I don't know if
being a sex worker and being an OnlyFans doesn't make you a bad person. I'm just saying. Well, I guess I make
no.
kind of that judgment, but like, there's definitely there's definitely. I don't think there's a gay lifestyle, but there's definitely a trans lifestyle when it
I would
comes
say
to
queer. Like if you're encompassing all of it,
what
it's
does queer mean. What does queer
I would
mean?
I would define it. So it's a loose term, but I would define it as the encompassment of like all of the non-cishet experiences. So like you have ace is queer, gay is queer, bisexual, if you call it pansexual or whatever. There's like demisexual, and then you have trans people like non-binary, trans femme, trans masc, non-binary, and then there's binary, trans female, and trans male. So all of that is kind of ballooned, not ballooned. It's encircled in like this big bubble of queerness of little queer people.
Don't you think it will be easier moving forward as a society if instead of trying to cross over, we just expand definition of a man and a woman? Wouldn't it be more beautiful if we saw in the future men that do have long hair, wear makeup and whatnot, and
No,
identify as men and like
so if you do end up talking to Vosh, one of the things that you will learn, and something that I've personally learned from him, is that gender abolition is a thing. I think it's a wonderful thing. The long-term goal of our society should be the abolition of gender and gender roles. Instead of men and women and non-binary people, we just have people. Look, that guy's got a beard. I wonder if they also have a penis. I don't know for sure, and I can't know unless I pull their pants down, and unless I'm sexually interested in them, it won't matter. But maybe they have a beard, maybe they have the high voice, maybe they have long hair with, maybe they're skinny or fat. It doesn't matter. We're all just people at the end of the day. The
Mhm.
gender, the gen, so gender as a concept, I feel has outlived its usefulness. We don't really have a
So we have
purpose to
only
keep it going.
sex. Maybe we should just go back to sex.
Yeah, well, yeah. I mean, the sex, like I said, the sex. What is it? I can't think of the term. I'm blanking out. It's the term I said. The sex. Hold on.
All I'm saying, I wish somebody told me you're not a special kind of a woman, you're a special kind of man. And that would have saved my genitals and my health. And
Bimodal
I feel like
distribution. Sorry.
that's where I stand with my experience. And I feel like I wish instead of trying to live cells and like trying to mask among women for the last 10 years, I was just use those 10 years, I mean, not 10 years, yeah, 10 years, a decade I've lived, I guess,
Right.
as a woman, quote unquote. I would have spent those years expanding the definition of a man. But unfortunately, when I was transitioning, I didn't have examples of people like Jeffree Star or James Charles, people who look no different in a lot of ways than average trans women. All they need to do is throw on a wig and some
Well, yeah.
makeup. But I know people would attack me and be like, that's not what trans woman means. But at this point, it's transphobic to say that you have to take hormones to be trans, right? So
Yeah, I mean, it is. I could wake up tomorrow and decide I'm trans.
yeah, exactly. So it really means nothing. I just feel like we lost definition of what trans means.
I, in many ways,
when I was
agree.
transitioning,
That's gender abolition, baby. That's what it's all about.
I know, but none of this means anymore. I don't know if having 100 different labels does any good anyone, or having all these
I'm with you.
neopronouns.
That's why I just say ditch
No,
them.
you're not with me. You're literally
But
asking me, are there what my
I feel like
pronouns
we're
are.
kind of on a wavelength here. You don't like the 100 different labels. I don't like them. I think that sometimes it gets a little bit, too much. I have to remember all these things, remember all these pronouns, whatever. And I respect people and I respect their decisions. But at the end of the day, I would love to just say, fuck it all, get rid of it all. No more men, no more women. We're all just big genderless blobs and we will all present the way we want and just be human beings. I agree. I think that would be
I would love
thing.
that. Yeah, I would like to just not do pronouns, but like, I don't know. I feel like people transitioning kind of set back the whole gender nonconformity things, because at this point, if a man wears something that's not traditionally masculine, I feel like people are gonna assume that he's possibly transitioning, gonna as a gender, like the pronoun thing. I just feel like like back in I wasn't alive back then, but I believe 80s or 70s they had like androgynous people keep on saying like David Bowie and all those people, Boy George. They were man and woman who were just wearing whatever. But transing, it's kind of just emerged like not that long ago, and I feel like I got caught up in it too. And I don't know how I went from being like a proud transsexual, to being full on convinced that I'm a woman, and I was like, I don't need my dick. I am a woman. I'm
right,
no
but
different
you
than
never
another
actually
woman.
thought that you had, like, for instance, XX chromosomes. You never actually thought that like you had ovaries and a uterus. And I feel like sometimes the rhetoric that goes around, and especially like anti-trans communities, is like, oh, we're trying to convince people that genes don't exist and that if you have a penis, well, no, you don't. You're a trans woman. And that's just silly. Like, trans women who are pre-surgical and maybe they don't want surgery, they know they have a penis. They know. They see it every day. And some of them want it and some of them don't. And some of them take care of that by going through the surgical process. And most people who do that generally turn out great. They love it. So the surgical process can
Do you
only go up.
personally, have you ever had sex with a post-op?
I have not. No, I've my sexual experience is admittedly a little limited.
Do you know anybody in your immediate circles that are attracted to men that had the surgery, who date men?
Somebody who's had the surgery who dates men?
Yeah.
Well, I can tell you for a fact, I went viral on Twitter a little bit ago, and I had quite a few trans people say quite a few things about me. So it definitely does exist.
I mean, but you don't know anybody personally, right, who had the surgery and dating men?
Not personally, no.
So how are you saying it works out for the most people? Like, where is that most people coming from?
For surgery?
Yeah, like you just made a statement that it works out great for most people. So
in medicine, we go off of kind of a subjective quality of life. Now, there are objective measures. We can determine whether or not you have increased depression or if you have increased difficulty living your life day to day. But generally, it's like, okay, are you happier after this procedure? Is your life better? Like, take this survey. Like, what do you think? That's very important to us. You just went green. But back to my point, like, that's a very important element when we consider treatment options. And again, I just like, there's so much that's just lost in this conversation. And I wish people would take subjective experience more seriously, because a lot of things in medicine have to be subjective. There's an entire, if you're, as a nurse, there is an entire subjective analysis that we do on people. And part of that is sometimes is screening for depression, which is entirely subjective.
So you don't know where, like, if people who have the surgery have mostly good experience, right?
No, we do know that. So we've taken surveys of these things. The data that we have overwhelmingly supports people who do the surgery and are obviously educated and whatever.
I'll send you a study where
outcomes.
Yeah, go ahead.
Sorry.
Yeah, I'll send you a study that was done in Sweden where.
Yeah, so I know that study you're talking about. And the writers of the study actually said, please stop using this to speak out against trans people. The study was done to compare post-op trans people to the general population. It does not compare post-op to pre-op. So post-op people after transgender procedures still have a higher suicide rate, a higher rate of anxiety and depression, and that's expected. They're still trans. They probably still have features of themselves that are equivalent to the other sex, and they didn't determine whether or not their overall risk went down. Other studies
But
did.
wasn't the point of medical
Plus, that study, I want to stress, is kind of old.
Yeah.
So,
wasn't the point
but I do know the study you're referring to. Hopefully that cleared that up.
But wasn't the point of the whole transition was to elevate depression, anxiety, and suicidality? You literally just said that, like, oh, there's still chances they're going to have all these, like, issues. So that's the whole point. Transition did not elevate any of my issues. I realized, like, I had childhood trauma. I had depression, anxiety due to that as well. So it's like none of the shit was tackled before I was given letters for the surgery. So it's like I was made to believe that the reason I was feeling sad, depressed, and suicidal was because I was in the wrong body. Like,
mistakes do happen. They happen in every element of society.
So I'm a mistake, right?
Every element of medicine, I mean. Sorry, what'd you say?
So I am just a mistake, just a fluke
I'm not
accident.
saying you're a mistake. I'm saying clearly there were mistakes made along your path. And that's incredibly unfortunate. That's something that I experience a lot working in mental health care, working in especially drug rehab. They treat these people like they're subhuman, and they just quite frankly don't care. I had a guy go to the hospital over the weekend with swollen hands. They looked like big meaty Mario gloves. And they came back and they were like, oh yeah, he's got high blood pressure. He has no feeling in his hands. What do you mean he has just high blood pressure? Like, I get it. Medicine is not perfect in this country or any country, but all we can do is improve upon it and go off of objective data that we have. You know what I mean?
I thought I was safe because I came from a country where medicine is shit. So I thought, like, I'm in a first world country and I'll be well taken care of. And instead my life kind of has been ruined for the most part. I lost the ability to connect with people on a deeper, I guess, sexual level. Yeah, I mean, what happens in a few years? We see a wave of suicides among detransitioners and kids that have been transitioned. Like, will your mind change or like?
Absolutely. No. If we see in a few years, like, look, all these trans people who went through these procedures just suddenly got really depressed and all succumbed to suicide. Yeah, that's huge. Of course I would look at that. I'd be like, maybe we need to revisit this, but we just don't have that yet. So we can't go off hypotheticals.
If that happens, like, would you then say that right now and what happened within the last 10 years or so was just experimental?
Would I say that it was experimental? No, this is clinically not considered experimental. This is based off of best practices. We're also going off of, again, I want to stress that is a little bit of an extreme hypothetical, but nonetheless, I do want to address it fairly. It's still not considered experimental. If we find something better, then that'd be great. If we could rewire the brain and that's an easier, less invasive and more effective process, I think that'd be wonderful. But we just simply do not have that technology. And the best research that we have points toward hormone blockers, hormone replacement, and potentially sex reassignment surgery, SRS.
Okay, and before I jump off, I would like you to send me a study where it says that sex reassignment surgery helped people in the long run, because I do have my friend April slash Taftash, and she went through a lot of studies and she found out that only HRT was helped people improve their mental health, but it wasn't significant statistically. And she couldn't find any studies where it shows that SRS did anything for people's mental health in the long run. So if you find any study like that, please send it to me, because I would love to look at it. I'm not the most statistical person, but my partner can look at it. And I do have like a large following of people that are in all kinds of professions. I'll look at it too. I would like to know, because I do have trans friends and detrans friends. So I do, and I'm obviously like a transition all the way, whatever I could do. So yeah, I would like to know like what are the likelihood of me like surviving in the long run.
Sure. This is something I just found on Google. It's a association between gender affirming surgeries and mental health outcomes by Almazan and Kuroglian. I don't know how to pronounce that. From 2021.
I want specifically bottom surgery, not the top surgery.
Bottom surgery?
Yeah. The bottom surgery.
Study. And this study was performed, design. Okay.
You don't have to look right now. Whenever you find it, you can send it to me. Like, if I would appreciate that. And also the example was a 22-year follow-up. Was it among the links that you sent me on Twitter?
What was it?
I remember you brought up an example. It was a 22-year follow-up.
Yes.
Was it among the links that you sent me? I remember you sent me like a giant paste of like links.
That was one of the links I sent. That was it is called. It's from the National. No, is it from the? Hold on. It's from the Journal of Clinical Endocrinology and Metabolism.
Right.
That's academic.oup.com, and then the rest of it is in the link.
Awesome. Well, just send me that link when you get a chance. Anyways, thank you so much, Alec. I appreciate this so much, and hope to see you again on my channel. Hopefully, we'll discuss some other subjects. I kind of froze up. I don't know. I was like mumbling, so I may have to like edit myself out a little bit of that video. But all of your parts are staying, unless you want me to edit something out.
No, of course. I'll be uploading this unedited to my YouTube channel as well. So
yeah, I'll probably I liked our conversation once I stop recording, so I may use some of that too and just like upload it as well as a separate video, if that's okay.
Absolutely.
Yeah, of course. Thank you so much for your time. I appreciate this so much. And maybe someday, like I know James from Modern Day Debate. I feel like you would make a good debater.
Thank you. I have a few debates up on my channel.
Yeah, I know. I saw it, but like Modern Day Debate is just like larger platform, you know.
Ooh,
and he was trying to get me to like do 2 trans people debating 2 detrans, but I said because the trans community is so like nobody is communicating with each other, so that's being done on purpose. So it's been so hard to coordinate that. So at this point, I'm like, you know what, bring on Waush, because you call the transitioners grifters. So I'm like, okay, there's already ongoing drama and beef. But then the persons that I saw like would be a good match to Waush, which is like Tulip R. You might have seen him on Twitter. He kind of doesn't want to debate Waush, and then the other kid, Isaac Uncooked, who's also another detransitioner.
I can't get into debate Waush either. He's quite the he's
intense, right? I think like he'll eat me up for sure.
Yeah.
I don't know, unless I pop Xanax or something. Even then, I don't know. Like I need to do something with my anxiety to go up against him.
It is anxiety inducing no matter what. I was a little anxious coming into this, so I completely get it.
Yeah, but it went well, because my point wasn't to like put anyone down or yell at anyone like it happens at debates. You know, it was just like to really, because my audience are anti-blockers. I am anti-hormone blockers. I just wanted to hear like the other side, you know.
Did any of what I said maybe pull you over a little bit or make you think about things?
From my lived experience, obviously I wasn't a trans kid per se, even though according to TRAs, like everybody who's trans now was at some point trans kid, you know, we just didn't have a chance to medically transition. A lot of times I saw how my life would have been different had I been blocked out early on and would have been more passable, quote unquote. Maybe my life would have been easier. But looking back, I honestly, that's what I was trying to say. That's why I wish I had more time with my dick, because I realized that was the best time. You know, I should have stayed a trans woman and should have not tried to become a woman, you know, because my goal with transition was to leave cells, because I got brainwashed that with the surgeries, I'm no different than any other woman, except for not having my periods and a few other things. But other than that, they were like, yeah, you're just gonna be like any other woman. And I was like, yay, that's what I want. I don't want to carry the trans label till the rest of my life, you know. And yeah, so but I shortly after I realized I wasn't that passable, that I wasn't this pink bubble where all the chasers and everybody who's trans supportive, and I was like, you're so beautiful, you're so passable. But once you go out in real world, people like they can tell you're a man. And that's like a
Unfortunately, you
really
are correct. The trans community can be very affirming, very overly positive, and it can be it's usually a good thing, I believe, but it can sometimes, I agree, give people false perceptions. So, hormone replacement therapy, especially later in life, is not magic. It's not going to completely transform you. And I want to stress, I'm very sorry about your experience and that was negative. I am a huge advocate for people who are detrans. I believe it's a problem that exists, and it is something that I hope we do more research on so that we can minimize the number of people who end up being detrans. I believe that we need to embrace them as well and let them share their experiences. But I also believe that we need to not weaponize those individual experiences
Bitch, you're
to
bald. I
overcome
don't
the
give a fuck
overall
about your
narrative
opinion on this
and
issue.
the
What the fuck?
literature and the science and the data, and overwhelmingly supporting these procedures. I think we can have honest conversations without doing that. You know what I mean?
right. But I mean, do you know that like hormones are not FDA approved for gender dysphoria? It's just like prescribed pretty much off label.
Yeah, but also trazodone is not really approved for sleep, and yet we pretty much only give that for sleep. So, there are medications, a lot of medications like that, and that's another thing that needs to be revisited in total by the entire medical facility, or the entire medical community. I agree that we need a whole second look at the whole medical community. There are glaring issues, but it is
I
not
guess
specific to trans care.
the last thing I want to say, I guess, in time, everything shall be revealed because we're literally in the middle of history in making. So,
We sure are. It's interesting times.
one more question: do you
Sure.
know Dylan Mulvaney?
One more time.
Do you know Dylan Mulvaney?
Dylan
The one that's like
Mulvaney. I can't say that I do.
Days of Girlhood, the guy that went to meet Biden. I mean, sorry, it's a trans
Oh,
woman.
wait. Yeah, I did see her. No, that was the post that I originally replied to you on.
Oh, really? That was it. So, do you think he's trans woman, and do you think it's a good representation of transgender community?
I haven't looked into her enough, but I would have no reason to assume that it's bad. I have to look into her specifically more. There are certainly trans people who are a bad look sweetie, if you will. So maybe she's one of them. I have no clue. I'd have to look
Well,
into it.
she has 8 million subscribers on
Oh, wow.
TikTok. So,
Oh, wow.
yeah, I guess. And she's on day 222 of girlhood, whatever that means. Like,
Okay.
yeah.
Interesting.
Yeah.
I'll have to look
Anyways,
into her more. I'll get back to you on that.
thank you so much. I'm going to jump
Absolutely.
off. Thank you for everything. And good night. Bye bye.
right. Have a great night,
Okay.
Shapeshifter. It was
You
a pleasure
too.
being here.
Just send me the link to this video, okay, that you uploaded on your YouTube. I'll look it up as well now.
Will do. Absolutely.
Okay, thank you. Bye.
Yep.
Bye.
Have a wonderful night.
You too. Bye.
Okay. I think that went well. What do you guys think? I feel informed and entertained. It went fine. Excellent. 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 I think you did great. Thank you. I think I carried myself pretty well. I'm not one to, I mean, let's be honest. I'm one to absolutely toot the fuck out of my own horn, okay? But all things considered, I think that went really well. Is that a real lab coat? This is in fact real. It's not a lab coat. It is my nurse coat. So I decided for tonight, you would notice I don't have the bi lighting on. I still have like my whole decoration, but I'm not fucking with that. I have the, I wanted to be professional. I wanted to make sure that I presented myself professionally, intellectually, because this person, shapeshifter, and I don't want to be disrespectful because we haven't, I don't like the things that shapeshifter just said about like the entire trans community, but I do feel like I bit back on that at least. But I wanted to come off as professional because this person has ties to Buck Angel and Blair White. And they are quite influential. So I wanted to make sure that I came off as professional and as knowledgeable as possible. And I think I did a great job. If they do end up uploading this to their channel, I think honestly it will get quite a bit of attention. You know, a little nervous about that, to be honest with you. But yeah, all things considered, I think I need more lube. Go for it. Go at it, bud. You did very good. Thank you. My lab coat is not from work. This is from Mount St. Joseph University, the nursing program. I thought about putting on my badge, but I decided against it because I don't want to dox myself. So my badge has my place of work on it, and I'd rather people not know where I currently work. You should post it on your channel. I will post the entire unedited conversation to my channel. I like keeping those conversations entirely unedited besides an intro and an outro. That way people know that I'm not cutting stuff. That way people know that, like, you know, if they upload it, right? If Shapeshifter uploads it to their channel, they said they're probably going to edit some stuff out where they looked bad. I don't know what that means. So, you know, one of my fears going into this was that I would be clipped out of context because I don't know Shapeshifter that well. Now, will they do that? I don't know. Maybe they're completely a cordial person up front, but will turn around and try to, you know, stab me in the back. Who knows? I didn't get that impression, but I don't know them. So betting it will get a clickbait title and thumbnail. A lot of things they said is subjective that they made seem like objective. Yeah, but I think I fought against that well. I'm like, look, here's the thing. Don't ever minimize their personal experience. You cannot do that. Because if you do that, that makes you look like an asshole. And I think, honestly, I don't know, but they might have been trying to do that a little bit. You know what I mean? Like bringing their personal self into it so that I could be like, that doesn't matter. What are you talking about? Your life doesn't matter. Your experiences are wrong. They're wrong. When that's not true. I did say it's an uncommon experience for trans people to have. I also addressed the issue that we have with insurance, that we have with people being rushed into procedures in general. I always tied it back to like the overall state of the medical industry. And I think that's important to do. The debate of the topic was, I was presenting on puberty blockers for children, specifically trans children and gender nonconforming children. And also, I learned a lot. I learned a lot from this little project, and I hope you guys did too. Just real quick, if you are watching on YouTube, thank you so much for watching. I really appreciate you making it all the way through this. I will be putting timestamps. Don't worry, I will be putting timestamps to kind of segment out the educational session in case that bores you. I get that was kind of a long session that we did, but I felt like it was very important to set that up piece by piece by piece so that I didn't slip up, so that I didn't say anything that could get clipped. And if it did get clipped, then I could back it up with an actual, context, you know? So I was very careful, and I feel like I did a good job. Like I said, though, thanks again for watching. I would like to shill, for once, my Discord channel. If you are here watching the video, every single YouTube video, I show my Discord channel in the description down there, right on there. And you can click that, and you can come join us in the Discord. That I'm pointing at my other monitor for some reason. You can come join us in the Discord. You can have a nice little discussion with me, with all the other peeps, and it'll be nice. It'll be a nice time. It'll be a good time. Also, if you're in the chat, all you have to do, !Discord, boom, and you can come join just like that. And if you aren't in the chat, get in here. What are you waiting for? Look at all these beautiful gay little people on my computer. You could be one of these little queer people. What do you think? Pretty sweet deal. Pretty sweet deal. Anyway, thanks again for watching, and I will see you all in the next video.